Question 1. A BCBA designs a new behavior plan. Ethically, before implementing it with a client, they must A. Get the plan approved by a colleague. B. Ensure the client or their legal guardian has given informed consent. C. Confirm it uses only positive reinforcement. D. Begin data collection for 5 sessions. Answer: B. Ensure the client or their legal guardian has given informed consent. This question is about the ethical requirement of informed consent before starting services. The key phrase, "before implementing it," highlights this critical step. Informed consent means explaining the proposed plan, including potential benefits, risks, and alternative options, and getting voluntary agreement from the client or their legal guardian. This must happen before you start putting the plan into action. While getting input, A. Using positive reinforcement, C. Though not always required, and collecting data, D. Needed for baseline, but consent comes first, are all important aspects of ABA practice. Consent is the non-negotiable first ethical step before implementing any plan. Question 2. You are collecting frequency data on a child's hand raising during a 20-minute observation. In ABA, what is the behavior you are observing and measuring called? A. The antecedent. B. The target behavior. C. The consequence. D. The stimulus. Answer: B. The target behavior. This question asks for the term used to describe the specific behavior you are focusing on and measuring in an intervention or observation. The behavior you want to change, track, or understand is called the target behavior. It's the bullseye of your efforts. The antecedent is what happens before, the consequence is what happens after, and a stimulus is anything in the environment. Whether you want to increase hand raising or decrease hitting, that specific action is your target behavior. Question 3. A child screams when asked to put toys away. The screaming results in the parent putting the toys away for them. In the future, the child screams more often when asked to clean up. This is an example of behavior maintained by A. Social positive reinforcement, attention. B. Social negative reinforcement, escape. C. Automatic reinforcement. D. Access to tangibles. Answer: B. Social negative reinforcement, escape. This scenario describes behavior maintained by negative reinforcement, specifically escape from a task that is socially mediated, involves another person. The antecedent is being asked to clean up, a demand. The behavior is screaming. The consequence is the parent completing the task, meaning the child escapes the demand. Since this escape makes the screaming more likely in the future when faced with cleanup, the behavior is reinforced. It's social because the parent is involved, and negative because something unpleasant, the task, is removed. Question 4. When selecting a measurement method, you should choose one that accurately reflects the dimension of the behavior you want to change. If you want to increase the time a student spends working on their assignments, the most appropriate dimension to measure is A. Frequency. B. Latency. C. Duration. D. Inter-response time, IRT. Answer: C. Duration. This question asks you to match the behavior dimension to the appropriate measurement method. You want to increase the time spent on a task. Duration is the measurement of how long a behavior occurs from start to finish. If you want the student to work longer, you measure duration. Frequency counts how many times they start/stop. Latency is the time until they begin working. IRT is the time between instances of working. Measuring the total time engaged is done with duration. Question 5. A stimulus that reliably predicts the availability of reinforcement for a specific behavior is called A. Conditioned reinforcer. B. Motivating operation, MO. C. S delta, S delta. D. Discriminative stimulus, SD. Answer: D. Discriminative stimulus, SD. This question defines a discriminative stimulus, SD. An SD is an environmental cue or signal that has been associated with the availability of reinforcement for a particular behavior in the past. It sets the occasion for the behavior because responding in the presence of the SD has paid off before. Seeing a familiar logo on a coffee shop, SD, signals that going inside and ordering coffee will likely be reinforced, you'll get coffee. An S delta signals no reinforcement. Conditioned reinforcers are learned rewards. MOs change motivation. An SD tells you, go for it now. Question 6. What is the term for an intervention procedure where reinforcement is delivered for the occurrence of a behavior that is physically impossible to perform at the same time as the challenging behavior? A. Differential reinforcement of other behavior, DRO. B. Differential reinforcement of alternative behavior, DRA. C. Differential reinforcement of incompatible behavior, DRI. D. Differential reinforcement of low rates, DRL. Answer: C. Differential reinforcement of incompatible behavior, DRI. This question describes differential reinforcement of incompatible behavior, DRI. The key word is incompatible, meaning the desired behavior cannot physically happen at the same time as the problem behavior. You reinforce the incompatible behavior while putting the problem behavior on extinction. For example, reinforcing a child for having hands in pockets is incompatible with hitting or hand biting. DRA reinforces any alternative behavior. DRO reinforces the absence of the problem behavior. DRL reinforces low rates. DRI targets a behavior that physically prevents the problem behavior. Question 7. When teaching a new skill, you provide extra help or cues to ensure the learner responds correctly. This extra help is called A. Reinforcer. B. Consequence. C. Prompt. D. Stimulus. Answer: C. Prompt. This question asks for the term for the extra assistance given during teaching. A prompt is any supplementary stimulus or help added to the environment before or during a response to make it more likely the learner will perform the correct behavior when the SD is present. Prompts are designed to increase the probability of a correct response so it can be reinforced. Reinforcers and consequences happen after the behavior. A stimulus is a general environmental event. Prompts are the specific forms of help we use. Question 8. What is the purpose of collecting baseline data before implementing an intervention? A. To punish the target behavior. B. To determine if the intervention is ethical. C. To establish a stable rate of behavior to compare the intervention's effects against. D. To reinforce the target behavior. Answer: C. To establish a stable rate of behavior to compare the intervention's effects against. This question asks about the fundamental reason for collecting baseline data. Baseline data is measurement of the behavior before any intervention is started. It provides a picture of how often, how long, or how intensely the behavior occurs naturally. This information serves as the comparison point to evaluate whether your intervention caused any change. You need that before picture to see if your after picture looks different because of what you did. Baseline provides the standard against which you measure intervention effectiveness. Question 9. A child learns to say car when shown a picture of a car. Later, they see a real car, a toy car, and a car on TV, and say car for all of them. This is an example of A. Stimulus discrimination. B. Response generalization. C. Stimulus generalization. D. Behavioral contrast. Answer: C. Stimulus generalization. This scenario illustrates stimulus generalization. The child learned a response, saying, car, in the presence of one stimulus, a picture. Stimulus generalization occurs when the same response is emitted in the presence of different, but similar, stimuli, real car, toy car, TV car. The behavior has generalized across variations of the stimulus. Stimulus discrimination is responding differently to different stimuli. Response generalization is doing different behaviors to the same stimulus. Question 10. What is the primary definition of punishment in ABA? A. A consequence that makes a behavior unpleasant. B. Providing a timeout after a behavior. C. A consequence that decreases the future frequency of the behavior it follows. D. Taking away a preferred item after a behavior. Answer: C. A consequence that decreases the future frequency of the behavior it follows. This is another core concept, defining punishment by its effect. Punishment, whether positive, adding something, or negative, removing something, is defined only by its effect on the behavior. It makes the behavior it follows less likely to occur in the future. It doesn't matter if it feels unpleasant, A, involves timeout, B, or taking away an item, D. Those are types or feelings associated with punishment, but the definition is about the observed decrease in the behavior's future likelihood. Punishment is all about making the behavior happen less often. Question 11. When using a shaping procedure, you are reinforcing A. Any behavior that occurs during a specific interval. B. Steps in a behavioral chain. C. Responses that are closer and closer to the target behavior. D. Behaviors that are incompatible with a problem behavior. Answer: C. Responses that are closer and closer to the target behavior. This question asks about what is reinforced during shaping. Shaping is used to teach new behaviors that the learner doesn't currently perform. It involves reinforcing behaviors that are gradually more like the desired final behavior. You start with a rough approximation and reinforce it, then require a slightly better version to get reinforcement, and so on, reinforcing successive approximations towards the target behavior. Any behavior in an interval relates to DRO. Steps in a chain relate to chaining. Incompatible behaviors relate to DRI. Shaping is about reinforcing progress towards a new behavior's form. Question 12. A stimulus that has been paired with a primary reinforcer and now functions as a reinforcer itself is called A. Unconditioned reinforcer. B. Generalized conditioned reinforcer. C. Conditioned punisher. D. Conditioned reinforcer. Answer: D. Conditioned reinforcer. This question defines a conditioned reinforcer, also known as a secondary reinforcer. These stimuli were originally neutral but gained their reinforcing power by being repeatedly paired with primary reinforcers, like food or water, or already established conditioned reinforcers. The phrase, paired with a primary reinforcer and now functions as a reinforcer, is the definition. Money, praise, and tokens are common examples. An unconditioned reinforcer is naturally reinforcing. Conditioned punishers decrease behavior. A generalized conditioned reinforcer has been paired with many reinforcers. This is the general term for a learned reinforcer. Question 13. Which dimension of behavior measures the time between the presentation of a stimulus, like an instruction, and the beginning of the behavior? A. Duration. B. Latency. C. Frequency. D. Inter-response time, IRT. Answer: B. Latency. This question asks about the measurement dimension called latency. Latency measures the time it takes for a behavior to start after a specific cue or stimulus is presented. The key is the time from the stimulus, instruction, to the start of the response. If you say, stand up, the latency is the time from the end of you saying, stand up, to when the person begins to move to stand. Duration is how long the standing lasts. Frequency is how many times they stand. IRT is the time between two instances of standing. Latency is the response time after the cue. Question 14. What is the main goal of a functional behavior assessment, FBA? A. To eliminate challenging behaviors. B. To determine the function, purpose, of a behavior. C. To teach the client replacement behaviors. D. To identify potential reinforcers. Answer: B. To determine the function, purpose, of a behavior. This question asks about the core purpose of an FBA. A functional behavior assessment is a process used to figure out why a behavior is happening, what purpose it serves for the individual. This why is called the function. The FBA aims to identify the environmental variables, antecedents and consequences that maintain the behavior. Knowing the function is critical for developing effective interventions, which might involve eliminating behaviors, A. Teaching replacements, C. Or identifying reinforcers, D. But these are outcomes of the FBA process, not the goal of the assessment itself. The goal of the FBA is to understand the function. Question 15. When using a timeout procedure, timeout refers to removing the individual from the opportunity to access A. The problem behavior. B. Consequences. C. Punishment. D. Reinforcement. Answer: D. Reinforcement. This question clarifies what timeout means in ABA. Timeout, specifically timeout from reinforcement, is a punishment procedure where the individual is temporarily removed from or loses access to a reinforcing environment or situation contingent on a behavior. The idea is that removing access to whatever reinforcement was available will decrease the behavior in the future. It's not just sitting somewhere unpleasant, it's time away from the opportunity to get good things, reinforcement. Question 16. A behavior plan includes reinforcing a child for raising their hand and waiting to be called on, while ignoring instances of calling out. This is an example of A. Extinction. B. Positive punishment. C. Negative reinforcement. D. Differential reinforcement. Answer: D. Differential reinforcement. This scenario describes differential reinforcement. Differential reinforcement involves reinforcing one behavior, hand raising and waiting, while simultaneously putting other behaviors, calling out, on extinction, withholding reinforcement, in this case, likely attention. You are differentially reinforcing one behavior over another. Extinction is just stopping reinforcement for a behavior. Punishment and negative reinforcement increase or decrease behavior based on consequences, but differential reinforcement specifically involves reinforcing a chosen behavior while withholding reinforcement for others. Question 17. A behavior technician is unsure how to implement a new behavior plan. Ethically, their best course of action is to A. Try their best and learn as they go. B. Implement the plan as they understand it. C. Ask their supervisor for clarification and training before implementing the plan. D. Refuse to implement the plan until they feel ready. Answer: C. Ask their supervisor for clarification and training before implementing the plan. This question addresses the ethical responsibility of a supervisee regarding competence and professional development. Behavior technicians, and all practitioners, have an ethical duty to practice within their competence and to seek supervision when needed. If they are unsure how to implement a plan, the ethical and responsible action is to ask their supervisor for the necessary guidance and training before attempting to implement it. Guessing A, B, could lead to ineffective or harmful intervention. Refusing entirely, D, without seeking support is also not ideal. Seek clarification from your supervisor. Question 18. When conducting a paired stimulus preference assessment, the practitioner presents A. One item at a time. B. Two items at a time. C. Multiple items in a line. D. Items based on caregiver report. Answer: B. Two items at a time. This question asks about the procedure for the paired stimulus preference assessment, also known as forced choice. In this method, items are presented to the learner in pairs of two. The learner chooses one item from the pair, and that choice is recorded. All possible pairs from the set of items are presented to determine a hierarchy of preferences. Single stimulus presents one, and multiple stimulus methods present more than two. Caregiver report is indirect assessment. Paired stimulus means presenting items in pairs. Question 19. What type of consequence involves the removal of a stimulus immediately following a behavior, which results in a decrease in the future frequency of that behavior? A. Positive reinforcement. B. Negative reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question defines negative punishment. The key clues are removal of a stimulus, something is taken away, hence negative, and results in a decrease in the future frequency of that behavior, hence punishment. Negative punishment means taking away something the person likes or has access to, immediately after a behavior occurs, and as a result, that behavior happens less often in the future. A child hits their sibling, behavior, and loses screen time, stimulus removed, leading to less hitting. Taking away something good to decrease behavior is negative punishment. Question 20. A cumulative record shows the total number of responses over time. If the line on the graph is steeper in phase B than in phase A, it indicates that the behavior's rate in phase B is A. Lower than in phase A. B. Higher than in phase A. C. The same as in phase A. D. 0. Answer: B. Higher than in phase A. This question tests your interpretation of the slope on a cumulative record. The slope of the line on a cumulative record indicates the rate of behavior. A steeper slope means the total count is increasing faster, indicating a higher rate of behavior. A shallower slope means a lower rate. A flat line means a zero rate. If the line is steeper in phase B, the behavior happened more often in a given amount of time during phase B than it did during phase A. Steeper slope equals higher rate. Question 21. You are teaching a child to request a break by saying, "Break please." They currently whine to escape tasks. You reinforce "break please" with a break from the task, and you no longer allow escape from the task when they whine. You are using A. Extinction and positive reinforcement. B. Negative reinforcement and punishment. C. Differential reinforcement, specifically DRA, and extinction. D. Shaping and negative punishment. Answer: C. Differential reinforcement, specifically DRA, and extinction. This scenario describes using differential reinforcement of alternative behavior, DRA, and extinction. You are teaching and reinforcing an alternative behavior, break please, that serves the same function, escape, as the problem behavior, whining. Reinforcing "break please" with a break is negative reinforcement for the new behavior. Simultaneously, you are implementing extinction for the whining by not allowing escape from the task when they whine. Differential reinforcement involves reinforcing one behavior over others. In this case, it's reinforcing the alternative request and putting the old whining on extinction. Question 22. What does it mean for a behavior intervention plan to be function-based? A. It only uses reinforcement procedures. B. It targets observable behaviors. C. It is developed based on the identified purpose or function of the behavior. D. It is designed to eliminate all challenging behaviors. Answer: C. It is developed based on the identified purpose or function of the behavior. This question is about function-based interventions. A function-based plan is one that is designed directly from the results of a functional behavior assessment, FBA. It targets the reason why the behavior is occurring, its function. This involves teaching the individual a better, more appropriate way to achieve that function, or replacement behavior, and/or changing the environment so the problem behavior is no longer effective in achieving the function. It's based on the why of the behavior. Question 23. When using a most to least prompting strategy, you start with A. No prompt. B. The prompt that provides the most assistance. C. A gestural prompt. D. The prompt that is easiest to fade. Answer: B. The prompt that provides the most assistance. This question asks about the starting point in a most to least prompting strategy. As the name suggests, most to least, you begin by providing the highest level of assistance that you believe will guarantee the learner performs the behavior correctly, like full physical guidance. You then gradually reduce the level of prompting as the learner demonstrates increasing independence. Least to most starts with no prompt or minimal help. Most to least starts with the most help. Question 24. Which type of measurement is useful for estimating the occurrence of behaviors that happen at a high rate or for long durations, but does not provide an exact count or total time? A. Frequency. B. Duration. C. Latency. D. Interval recording, example partial/whole interval, momentary time sampling. Answer: D. Interval recording, example partial/whole interval, momentary time sampling. This question asks about measurement methods that provide estimates, often used for behaviors difficult to track continuously or for very high rates/durations. Interval recording methods divide the observation into time blocks. You record whether the behavior occurs within or at the end of the interval, rather than counting every instance or timing the full duration. This provides an estimate, often a percentage of intervals, rather than an exact measure. Frequency and duration provide exact measures. Latency is time to start. Interval recording is about sampling the behavior's occurrence across time blocks for estimation. Question 25. A behavior technician observes a client being mistreated by a caregiver. Ethically, the technician's primary responsibility is to A. Ignore the situation to avoid conflict. B. Document the incident in their session notes. C. Immediately report the suspected abuse or neglect according to mandated reporting laws and agency policy. D. Discuss the issue with the caregiver. Answer: C. Immediately report the suspected abuse or neglect according to mandated reporting laws and agency policy. This question addresses the critical ethical responsibility of mandated reporting. Behavior analysts and technicians are often mandated reporters, meaning they are legally and ethically required to report any suspected abuse, neglect, or exploitation of a client to the appropriate authorities, Child Protective Services, Adult Protective Services, etc., according to local laws and agency policies. Client safety is paramount. Ignoring, A, is unethical and illegal. Documenting, B, is necessary but not sufficient as the only action. Discussing with the perpetrator, D, is inappropriate and potentially dangerous. Report suspected harm immediately. Question 26. What is the process of pairing a neutral stimulus with an unconditioned stimulus to elicit a conditioned response? A. Operant conditioning. B. Stimulus control. C. Respondent conditioning. D. Generalization. Answer: C. Respondent conditioning. This question defines respondent conditioning, also known as classical or Pavlovian conditioning. It's learning through stimulus-stimulus pairing. A neutral stimulus, like a bell, is repeatedly paired with an unconditioned stimulus, like food, that naturally elicits an involuntary response, like salivation. Eventually, the neutral stimulus alone comes to elicit a similar response, salivation to the bell, which is then called a conditioned response. Operant conditioning is about behavior influenced by consequences. Stimulus control is behavior occurring in the presence of a specific SD. Generalization is the spread of a response. Question 27. You are teaching a child to wash their hands. You prompt them through all steps except the very last one, drying hands, which they do independently. You reinforce this. Next time, you prompt all steps except the second to last and the last, reinforcing independent completion of those. This teaching method is called A. Forward chaining. B. Backward chaining. C. Total task presentation. D. Shaping. Answer: B. Backward chaining. This scenario describes backward chaining. In backward chaining, you use a task analysis and teach the steps starting from the end of the chain. You prompt the learner through the initial steps and reinforce them for independently completing the last step. As they master the last step, you teach the second to last step and the last step, reinforcing completion, and so on, working backward through the sequence. Forward chaining starts from the first step. Total task attempts all steps at once. Shaping teaches a single behavior through approximations. Backward chaining builds the chain by mastering from the end. Question 28. When creating a behavior intervention plan, it is essential to ensure that the recommended interventions are A. The easiest for the implementation team. B. The least expensive options available. C. Based on scientific evidence and the principles of behavior analysis. D. Preferred by the client's funding source. Answer: C. Based on scientific evidence and the principles of behavior analysis. This question emphasizes the ethical requirement for evidence-based practice. All recommended interventions in a behavior plan must be based on scientific research showing their effectiveness and align with the principles of behavior analysis. While cost, B, and ease of implementation, A, are practical considerations, they cannot ethically override the need to use scientifically supported methods. Funding source preference, D, is also secondary to ethical and effective practice. Always use interventions with a strong scientific basis. Question 29. A child typically engages in rocking back and forth when sitting quietly. Observations show this happens regardless of attention, demands, or access to items. The rocking appears to provide proprioceptive feedback. This behavior is likely maintained by A. Attention. B. Escape. C. Tangible access. D. Automatic reinforcement. Answer: D. Automatic reinforcement. This scenario strongly suggests automatic reinforcement. The clues are that it happens when sitting quietly, regardless of attention, demands, or access to items, and provides proprioceptive feedback, sensory input from joints and muscles. This indicates the behavior is maintained by the sensory consequence it produces directly, without needing anyone else to be involved. Attention, escape, and tangible access are all consequences delivered by others, socially mediated. Proprioceptive feedback produced by the behavior itself points to an automatic function. Question 30. What is the primary ethical concern related to the use of punishment procedures? A. They are always ineffective. B. They require more data collection than reinforcement procedures. C. They can have negative side effects and may not address the behavior's function. D. They are preferred by most clients and families. Answer: C. They can have negative side effects and may not address the behavior's function. This question highlights the main ethical concerns surrounding punishment. Punishment procedures, while sometimes necessary, can potentially lead to unwanted side effects like aggression, emotional reactions, or increased variability in behavior. Also, if not used as part of a function-based plan that also includes reinforcement of appropriate behaviors, punishment alone may only suppress the behavior temporarily without teaching a new skill or addressing why the behavior occurred in the first place. They are not always ineffective. A. Data collection requirements vary. B. And they are often not preferred. D. The potential for negative side effects and not addressing function are key ethical concerns. Question 31. You are collecting data on a child's yelling behavior using frequency. You decide to implement an intervention. Which type of graph would you use to display this data over time and evaluate the intervention's effect? A. Bar graph. B. Scatter plot. C. Line graph. D. Pie chart. Answer: C. Line graph. This question asks about the appropriate graph type for tracking behavior change over time. Line graphs are the standard in ABA for displaying data points across sessions or time periods because they allow you to visually see trends and compare performance between different phases, like baseline and intervention. Bar graphs compare different conditions, scatter plots show relationships, and pie charts show parts of a whole. For tracking behavior change over time to see if your intervention worked, use a line graph. Question 32. The process of teaching a learner to respond differently in the presence of different stimuli, example saying, red only when shown a red object and not when shown a blue object, is called A. Generalization. B. Shaping. C. Discrimination training. D. Prompting. Answer: C. Discrimination training. This question defines discrimination training. Discrimination training involves teaching a learner to respond in a specific way in the presence of one stimulus, the SD, and not respond, or respond differently, in the presence of other stimuli, S deltas. The learner is learning to discriminate or tell the difference between stimuli based on which one signals that reinforcement is available for a particular response. Generalization is responding similarly to different stimuli. Shaping teaches new behaviors. Prompting is giving help. Discrimination training teaches when/where to respond. Question 33. You have identified that a child's hitting behavior is maintained by attention from peers. Which function-based intervention would be most appropriate? A. Timeout for hitting. B. Ignoring the hitting behavior. C. Teaching the child to tap a peer on the shoulder to request attention and reinforcing tapping. D. Removing the child's preferred toys when they hit. Answer: C. Teaching the child to tap a peer on the shoulder to request attention and reinforcing tapping. This question asks for a function-based intervention when the behavior's function is attention from peers. Since the behavior, hitting, serves the function of getting attention, an effective intervention should teach the child a more appropriate way to get that attention. Teaching them to tap a peer on the shoulder and ensuring that tapping does get attention, reinforcement, is a function-based approach that teaches a replacement behavior. Timeout, A, and removing toys, D, are punishment that might decrease hitting but don't teach an alternative way to get attention. Ignoring, B, is extinction, which is necessary for the old behavior but doesn't teach a new skill on its own. Teaching a functional alternative, tapping, is key. Question 34. What is the term for a stimulus or event that occurs after a behavior and influences the future probability of that behavior? A. Antecedent. B. Behavior. C. Consequence. D. Stimulus control. Answer, C. Consequence. This question asks for the term that describes what happens right after a behavior. The consequence is anything in the environment that follows a behavior and has an effect on whether that behavior is more or less likely to happen again in the future. Reinforcers and punishers are types of consequences. The antecedent happens before, and behavior is the action. Stimulus control is when behavior is reliably cued by an antecedent. The consequence is the direct result of the behavior. Question 35. When establishing a token economy, the tokens themselves function as A. Primary reinforcers. B. Backup reinforcers. C. Unconditioned punishers. D. Conditioned reinforcers. Answer, D. Conditioned reinforcers. This question asks about the behavioral function of tokens in a token economy. Tokens, like stickers, points, chips, are not naturally reinforcing, not primary reinforcers, A. They gain their value because they are consistently paired with and can be exchanged for backup reinforcers, things the client actually wants, like toys, activities, snacks, B. Because their reinforcing value is learned through this pairing and exchange, tokens function as conditioned, or secondary, reinforcers. They don't decrease behavior, not punishers, C. Tokens are learned rewards used to increase desired behaviors.